Greater Manchester has become the first region in England to benefit from the government's 2014 Devolution Agreement, taking control of decision-making to improve the quality of lives for the 2.8 million people living there. Manchester Metropolitan University's Faculty of Health, Psychology and Social Care is at the forefront of evaluating the impact of health and social care devolution. We sent Catherine Jacob to Manchester to find out more.
Greater Manchester, the first region in England to transfer power away from national government to local decision makers, with its own mayor to control the big decisions on policing, housing, transport and, crucially, health and social care. One of those leading the devolved health and social care plan for Manchester told me that a potential £6 billion contract, the largest in the history of the NHS, would ensure hospitals, GPs, mental health services, social workers and voluntary organisations would work together to redesign the service they provide.
The City of Manchester is bringing together health and social care at a scale that's never been done before in the UK. And because we'll be designing new models of care and looking at new ways of intervening in population health and looking at prevention strategies, we will need the expertise of our university colleagues to evaluate what we're doing and to check and ratify what we're doing so that we can modify things as we go along for the good of the people.
In the heart of Manchester, a place of learning which is playing a crucial supporting role in evaluating the impact of health and social care devolution. Manchester Metropolitan University, which is carrying out groundbreaking research into health and social care devolution in the region. It's aimed to share its expertise and to work with experts within the community to improve the lives of the 2.8 million people who live here. The university's Pro-Vice-Chancellor of Health, Psychology and Social Care told me they're working very hard to ensure they're effectively training the healthcare workforce of the future.
Manchester Metropolitan University are working in very close partnership with a range of health and social care organisations, both the public, private and voluntary sector. We are involved in joint research projects, particularly around age-friendly neighbourhoods and community engagement, and we are working very closely with those organisations to ensure that their workforce is fit for purpose to deliver a truly integrated health and social care workforce.
Would you like your nails doing or anything?
A recent research project Manchester Metropolitan has been involved in was the Teaching Care Home pilot. The project worked with care providers, staff and residents to promote and support care homes to create a strong learning and development environment which aimed to enhance the residents' experience and support the professional development of care practitioners.
Part of the project for Teaching Care Homes was to recognise that care homes can be a fantastic learning environment, and that allows students to come in and see and view a different type of nursing, social care nursing, rather than the acute, fast-paced, high-turnover hospital nursing, which currently the curriculum's probably geared towards. So that's allowed that partnership, hopefully, for the future.
The staff at Rose Court are very clear about their mission and say the pilot scheme and training they've received in partnership with Manchester Metropolitan has been extremely helpful both for them and the care home's residents.
And it's got staff talking more about how they find what ways work with different residents, what routines are better, and it's just giving them more of a happier, safer environment to live in.
We do a reflective account every single day, so two staff members will sit together in the evening, have a chat, see how we think the day's gone, what's went good, what's went bad, and then we'll see how we can resolve it the next day to make sure it doesn't happen again and the best way to get around it and what works well for the residents.
Healthcare officials in Greater Manchester now have a unique opportunity to deliver care in a new way on an unprecedented scale, while tackling some of the poor health outcomes that blight the region. Manchester Metropolitan University will have a crucial role in the mission to bring health and social care back to the people.